Welcome to our deep dive. Today we'll be exploring the world of Medicare Advantage plans.
All right. Sounds good.
And we're really going to cut through the noise and give you the insights that you need to navigate this sometimes complex landscape.
It can be tricky for sure.
Yeah, and our listeners know the basics, but we really want to get to the nitty-gritty, the nuances, the strategies, and the things that most sources just kind of gloss over.
Absolutely.
And even touch on some potential future trends.
Yeah.
But first, let's just clarify the key difference between the two main paths you have when you become eligible for Medicare. We've got original Medicare with its fee-for-service model,
Right.
and then Medicare Advantage, where private insurers bundle coverage into these packages.
Bundled packages.
Okay. It's actually fascinating to see how Medicare Advantage has evolved
Yep.
since its introduction back in 1997. It started as a way to offer beneficiaries more choices, but now it's become much more about added benefits, catering to a more holistic approach to healthcare and even cost savings. What are your thoughts on this shift?
Well, I think what's really fascinating is how Medicare Advantage plans are responding to the changing needs and priorities of beneficiaries.
Yeah.
It's not just about basic coverage anymore. People are looking for more. They're looking for those value-added services, predictable costs, and a healthcare experience that aligns with their lifestyle.
Oh, right, exactly. Like those gym memberships some plans offer. It's almost like a wellness starter pack.
Kind of, yeah.
But with all these different plan options out there, how do you even begin to choose? We've got HMOs, PPOs, SNPs. It can feel like a whole new language.
Well, let's demystify that a little bit. So imagine you're at the doctor's office, right? With an HMO, or health maintenance organization, you're generally required to have a primary care physician within the plan's network, and this physician will then coordinate your care. So think of it like having a home base for your health care.
Oh.
This usually means lower costs, but less flexibility in choosing providers.
So it's about trade-offs then. What about PPOs?
So with a PPO, or a preferred provider organization, you have more freedom. You don't usually need referrals to see specialists, and you have more options outside the network, though staying in-network will usually mean lower costs.
Mm-hmm.
So if you value choice and flexibility, a PPO might be a good fit for you, even if it comes with a higher premium.
It sounds like choosing between a curated travel package or like planning your own adventure.
Yeah.
And then there are those SNPs, which sound pretty specialized.
Yeah, so SNPs, or special needs plans, are designed for individuals with specific conditions or circumstances, like chronic illnesses or residing in nursing homes. Imagine a plan that's been fine-tuned to address your unique needs, providing tailored benefits and care coordination.
That makes sense. And then there are the PFFS and MSA plans, which I have to admit I'm not as familiar with.
Okay, so let's imagine you want to see a doctor who isn't in a specific network.
Yeah.
With a PFFS, or private fee-for-service plan, you can do that.
Mm-hmm.
But the provider has to agree to the plan's terms. So it offers broader choices, but it hinges on provider acceptance.
Oh, interesting. So it's kind of like booking a hotel room. You have the freedom to choose, but you need to make sure the hotel's willing to accommodate you.
Exactly.
I like that.
And now, for those who prefer more control over their healthcare spending, there's the MSA, or medical savings account. Think of it like a high-deductible health plan with a dedicated savings account that you can use for qualified medical expenses. Medicare will actually deposit money into the account, and then you manage it.
So it's like having a healthcare piggy bank with some seed funding from Medicare.
Precisely. But remember, high-deductible plans mean you pay more out-of-pocket until you reach that deductible, so it's crucial to factor that into your decision.
Okay, so we've got this smorgasbord of Medicare Advantage plan types. Now let's compare them to original Medicare.
Okay.
When it comes to coverage, original Medicare has Part A for hospital stays and Part B for outpatient services like doctor visits. But original Medicare doesn't cover everything. It lacks coverage for vision, dental, hearing, and prescription drugs.
Generally, yeah.
And that's where Medicare Advantage often stands out by bundling in these extras and offering a more comprehensive package.
It does.
Right. It's like getting a fully loaded car instead of the base model. But what about costs? I know original Medicare has that 20% coinsurance and no out-of-pocket maximum, which can be a bit unsettling.
Yeah, that's a valid concern. So with Medicare Advantage, you often have set copays and an out-of-pocket maximum. So while you might pay more upfront in premiums, you have a cap on your yearly expenses, making costs more predictable. Think of it as budgeting for your healthcare with a safety net.
Yeah, that peace of mind can be invaluable, especially as we age and healthcare costs tend to rise.
Absolutely. But it's important to remember that cost predictability often comes with trade-offs, particularly with network limitations. With Original Medicare, you have the freedom to see virtually any doctor or hospital that accepts Medicare.
Right, but with Medicare Advantage, you're usually restricted to a network of providers,
Who are?
which could be a deal breaker for people who have established relationships with certain doctors
Right.
or need specialized care outside the network.
That's right. It's like choosing between a restaurant with a vast menu or one that specializes in a specific cuisine. You need to decide what best suits your taste and preferences.
I like that. And those prior authorization requirements
Yeah.
can be a hurdle. Tell me more about that.
So imagine needing a specific treatment and having to wait for your plan to approve it before you can get the care you need. These prior authorization requirements can sometimes delay access to care, which can be frustrating for patients and providers alike.
So it's an extra layer of bureaucracy that could potentially slow things down?
Yes, and it's essential to factor that into your decision, especially if you have a condition that requires timely intervention.
And one last thing to remember is that Medicare Advantage plans are regional, right?
That's right.
What's available in one area might not be in another.
Yes. So if you're planning to move, you might need to switch plans, which can disrupt continuity of care. It's like having a membership to a gym that only has locations in certain cities.
Right. Okay, so with all these factors to consider,
hmm
how can someone effectively choose the right Medicare Advantage plan for them?
Well, start by taking stock of your own healthcare needs. Think about your medical history, how often you see doctors, any specialists you rely on, and your priorities in terms of cost versus choice. It's about aligning your healthcare decisions with your individual needs and preferences.
So if you're relatively healthy and rarely see a doctor, a more restrictive HMO with a lower premium might be a good option.
Could be, yeah.
But if you value flexibility and see specialists often, a PPO might be worth the higher cost.
It might be, yes.
It's all about finding that sweet spot.
Exactly.
Yeah.
Once you have a sense of your healthcare needs and preferences, you can start comparing plans. Look at their provider networks, make sure your preferred doctors are included, and carefully review the plan's costs. Consider premiums, co-pays, deductibles, and the out-of-pocket maximum.
So it's like shopping for a new car. You got to look under the hood, kick the tires, and make sure it fits your budget and lifestyle. And don't forget to check the formulary, the list of covered drugs if you need prescription coverage.
Exactly. Choosing the right Medicare Advantage plan is an investment in your health and well-being.
Yeah.
It takes time and research,
Yeah.
but it's worth it to find a plan that gives you peace of mind and supports your healthcare journey.
All right, now let's talk about enrollment. You have to be enrolled in both Medicare Parts A and B to be eligible for Medicare Advantage
That's right.
and live in the plan's service area.
Yeah.
That makes sense. But when can you actually enroll? Are there specific windows of opportunity?
So the primary enrollment period is the annual enrollment period, which runs from October 15th to December 7th each year. Think of it as open season for Medicare Advantage. During this time, you can sign up for a plan, switch plans, or even return to original Medicare. There's also a Medicare Advantage open enrollment period from January 1st to March 31st, allowing you to make certain changes like switching to a different plan or disenrolling from Medicare Advantage and going back to original Medicare.
So there's some flexibility, but it's important to be aware of these deadlines
It is.
to avoid missing out.
Yes, Medicare has specific rules and timelines, so staying informed is key to navigating the enrollment process smoothly.
Now, before we delve into the common myths and misconceptions about Medicare Advantage, I'm just curious, what stands out to you so far about these plans? What's piqued your interest?
Honestly, I'm intrigued by the sheer variety of plans available and how they're evolving to address the growing need for a more holistic approach to healthcare.
Okay.
But I also wonder about the potential downsides. We've talked about network limitations and prior authorization requirements. But are there other things people should be wary of?
That's a great observation. One thing that often gets overlooked is the potential for plans to change from year to year.
Yes.
Benefits, costs, and even provider networks can be adjusted. So it's essential to review your plan annually during open enrollment to ensure it still meets your needs.
I agree. It's not a set it and forget it situation.
Right.
You need to stay informed and adapt as your healthcare needs and circumstances change.
All right, let's tackle some of those common myths and misconceptions about Medicare Advantage.
Yep.
One of the biggest ones is that it's the same thing as original Medicare, right?
Right. That's a common misconception.
Yeah.
So while both cover the same basic services, they're not identical twins. Medicare Advantage is run by private insurance companies, not the government.
Okay.
And it comes with its own set of rules, benefits, and costs.
So it's more like a cousin of original Medicare.
Yeah.
Similar DNA, but with its own distinct personality.
Precisely.
I like that.
Now, another myth is that all Medicare Advantage plans require referrals to see specialists. Remember those PPOs we talked about?
Yeah.
They offer more flexibility, and usually you don't need a referral to see a specialist.
So again, reading the fine print
Yes.
and understanding the specifics of each plan is crucial.
It is.
You don't want to be stuck with surprise costs or denied care because you didn't understand the rules of the game.
Exactly. Informed decision-making is crucial. It's about empowering yourself with the knowledge you need to choose a plan that aligns with your values and priorities.
All right, we've debunked some myths.
We have.
Now let's talk about prescription drug coverage, which is a major concern for many people.
It is.
How does that work with Medicare Advantage?
So most Medicare Advantage plans bundle prescription drug coverage, also known as Part D, right into the plan.
Okay.
These are called Medicare Advantage Prescription Drug Plans, or MAPDs.
MAPDs, got it.
And they can offer considerable convenience. Imagine getting all your medical and drug coverage wrapped up in one neat package.
It's like one-stop shopping for your healthcare needs.
Exactly.
But how do these MAPDs handle the sheer volume of medications out there? I mean, there are so many options, it can be overwhelming.
Well, that's where the formulary comes in. Each MAPD has a formulary, which is a list of all the prescription drugs covered by the plan. Imagine it as a menu of medications, each categorized into tiers with different costs.
So you might have a lower copay for generic drugs in Tier 1,
Right.
but a higher copay for brand name drugs in Tier 3.
That's the general idea. And it's important to check the formulary of any plan you're considering to ensure it covers your medications and that the cost-sharing structure aligns with your budget.
Because if your medication isn't on the formulary or is on a high tier with a hefty copay, that could negate the potential cost savings of Medicare Advantage.
It could. It's all about being aware of those details and making informed choices that fit your individual needs.
And speaking of details, before we dive into the potential future of Medicare Advantage, let's take a quick pause. Remember how you mentioned that Medicare Advantage plans can change from year to year?
Absolutely. It's like subscribing to a streaming service. The content library can change and new features might be added.
That's a great analogy. So it's essential to stay tuned and review your plan annually during open enrollment.
It is.
To ensure it still meets your needs.
Exactly. Medicare Advantage is a dynamic landscape, and staying informed is key to navigating it successfully.
This brings us to the question of how Medicare Advantage and supplemental insurance work together. Can you have both? I know a lot of people rely on Medigap to help cover those pesky out-of-pocket costs with original Medicare.
You raise a great point.
Yeah.
So Medigap plans are specifically designed to work with original Medicare, not Medicare Advantage.
Okay.
They're like two pieces of a puzzle that fit perfectly together, but they don't interlock with other pieces.
So it's like trying to fit a square peg into a round hole?
Precisely. You can't have both Medigap and Medicare Advantage. And the reason is Medicare Advantage often has lower out-of-pocket costs to begin with, plus those extra benefits, rendering Medigap redundant in many cases.
So it's like having two raincoats.
Yeah,
You don't really need both, especially if one is already keeping you dry and warm.
that's a great way to put it.
Now let's step back and look at the bigger picture.
Okay.
What do you think the future holds for Medicare Advantage, especially considering its growing popularity and the constant evolution of healthcare?
That's a big question.
It is.
Well, with over 50% of Medicare beneficiaries already enrolled, it's clear that Medicare Advantage is resonating with people.
It is.
But it's not all sunshine and rainbows, right? We've talked about the potential downsides like network limitations and prior authorization requirements. And then there's the ever-looming specter of legislative changes.
Right. Any shifts in funding or policy reforms could have a ripple effect.
Absolutely. Imagine a scenario where funding for Medicare Advantage is reduced. This could lead to higher premiums for beneficiaries, reduced benefits, or even changes in how plans are structured and regulated.
So it's a bit of a wait-and-see situation.
It is. And that's why it's crucial to stay informed about any legislative developments related to healthcare and Medicare. Knowledge is your most powerful tool in this ever-changing landscape.
Knowledge is power indeed. Okay, so we've covered a lot of ground in this first part of our deep dive into Medicare Advantage.
We have.
We've explored the different plan types, the pros and cons, and even touched on the potential future trends.
Yes.
But before we wrap things up, let's take a moment to recap the key takeaways for our listeners.
Okay.
What are the essential things they should keep in mind?
Okay. So first and foremost, Medicare Advantage is an alternative to original Medicare, offering bundled coverage through private insurance companies.
Okay.
These plans often include extra benefits like vision, dental, hearing, and even gym memberships, making them appealing to many.
Right. It's like getting more bang for your buck.
It is.
But with this added value comes trade-offs, such as network limitations and potential prior authorization requirements for certain services.
You've hit the nail on the head. It's crucial to weigh the pros and cons carefully. Consider your healthcare needs and prioritize the factors that matter most to you.
So it's not a one-size-fits-all situation.
It's not.
It's about finding the right fit for your individual circumstances and healthcare goals.
Precisely. And remember, knowledge is your best ally in this journey.
Right.
Take the time to research, ask questions, and advocate for your healthcare needs.
Well said. Now, before we move on to the next part of our deep dive, I want to leave our listeners with a little nugget of wisdom from our source material.
Okay.
Tucked away at the end of all this serious information about Medicare was a little slogan that made me chuckle.
Yeah.
If you don't know what to do, better call Buckaloo.
That's fantastic. It's a perfect reminder that even in the complex world of healthcare, there are humans ready to help and guide us through the process.
Exactly. Sometimes it's those little things, those unexpected moments of humor or clarity that can make all the difference.
They can.
So to our listeners, as we move on to the next part of our deep dive, remember to stay curious, stay informed, and keep those little nuggets of wisdom close at hand. We'll be back soon with more insights and explorations into the fascinating world of Medicare Advantage.
Sounds great. And sometimes those little nuggets lead us to discover a whole treasure chest of knowledge. It's like finding a hidden map that unlocks a whole new world of understanding. Speaking of maps, let's dive back into the intricate world of prescription drug coverage within Medicare Advantage. We touched on how most plans bundle this coverage, known as Part D, into what are called Medicare Advantage Prescription Drug Plans, or MAPDs.
Right, MAPDs.
But let's unpack how these plans actually work in practice.
Okay, so we know these MAPDs have formularies, which are essentially lists of covered drugs. It's like a menu of medications, each with its own price tag. But what are some of the factors that determine which drugs are included in a formulary, and why are some drugs more expensive than others?
Imagine you're putting together a cookbook.
Okay.
You'd want to include a variety of recipes that cater to different tastes and dietary needs.
Sure.
Similarly, a formulary aims to offer a range of medications that address various health conditions. But just as some ingredients are more rare or costly than others, some drugs are more expensive to develop and manufacture.
That makes sense. So newer brand name drugs are often placed in higher tiers with higher copays because they're typically more expensive than generic alternatives.
Yeah.
It's like choosing between a gourmet meal and a home-cooked dish. Both can be delicious, but one might be pricier.
Precisely. And it's not just about the cost of ingredients. Imagine two chefs using the same ingredients, but creating entirely different dishes.
Okay.
Similarly, two drugs might have similar chemical compositions, but vary in their delivery methods, formulations, or intended uses, leading to differences in cost and placement on the formulary.
Okay, so it's not always as simple as comparing apples to apples. There are nuances and complexities behind those formulary decisions. This reinforces the importance of carefully reviewing the formulary of any plan you're considering to ensure it covers your specific medications and that the cost-sharing structure aligns with your budget.
Absolutely. It's like planning a road trip. You wouldn't just set off without checking the map and making sure your car has enough fuel.
Right.
Similarly, you need to equip yourself with the knowledge and resources to navigate your healthcare journey effectively.
And remember those potential legislative changes we talked about.
I do.
How could those impact the prescription drug landscape within Medicare Advantage?
That's a really important question. And it's an area where we might see significant developments in the coming years. Imagine a scenario where policymakers introduce measures to lower drug prices.
Okay.
This could potentially lead to changes in how formularies are structured, the negotiation of drug prices, and ultimately the out-of-pocket costs for beneficiaries.
So it's like watching a game of chess where each move can have a cascading effect on the overall outcome.
Yeah,
We need to stay informed and adaptable as these changes unfold.
we do. Now, shifting gears a bit, I'm curious, what are some of the questions you've encountered about Medicare Advantage, perhaps from friends, family, or even your own research? What are some of the topics that people are most curious about?
Well, one question that seems to pop up frequently is whether Medicare Advantage is a good fit for people with chronic health conditions.
Right.
I mean, these individuals often have more complex healthcare needs, require specialized care, and rely on a consistent team of healthcare providers.
That's a crucial consideration. It's like choosing a travel companion.
Okay.
You want someone who's reliable, adaptable, and can handle the unexpected detours that might arise along the way. Similarly, for someone with a chronic condition, choosing a Medicare Advantage plan is about finding a healthcare partner who can provide the specialized support, coordinated care, and consistent access they need.
So it's not just about basic coverage. It's about having a healthcare team that understands your unique needs and can help you navigate the complexities of managing a chronic condition.
Precisely. And there are Medicare Advantage plans specifically designed for individuals with chronic conditions. These plans, known as Special Needs Plans or SNPs, often offer tailored benefits, care coordination programs, and access to specialists who are experienced in managing those specific conditions.
So it's like having a personalized travel itinerary that's been carefully crafted to accommodate your individual preferences and needs.
Exactly.
Now, another question that comes up is about the social aspects of healthcare. People want to know if Medicare Advantage plans offer any benefits or support for things like social activities, transportation, or even meal delivery services.
That's an insightful observation, and it reflects a growing recognition that healthcare is about more than just treating illnesses. It's about supporting overall well-being, which includes social connectedness, access to resources, and assistance with daily living activities.
It's like the difference between simply visiting a city and truly immersing yourself in the local culture, connecting with people, and experiencing all that the city has to offer.
Exactly. And you'll be glad to know that some Medicare Advantage plans are stepping up to address these broader needs. Imagine having access to transportation services that can take you to doctor appointments, social gatherings, or even the grocery store.
Okay.
Or envision having a plan that provides meal delivery services, ensure you have nutritious meals, especially if you're recovering from an illness or have difficulty preparing food.
Those are fantastic examples of how Medicare Advantage plans are moving beyond traditional healthcare models to embrace a more holistic approach to well-being. It's like having a concierge service for your health and lifestyle needs.
And let's not forget about the role of technology in enhancing healthcare experiences.
Right.
Imagine having access to telehealth services that allow you to consult with your doctor from the comfort of your own home, saving you time and travel expenses. Or envision a plan that provides remote monitoring devices, allowing your healthcare team to keep track of your health status and intervene early if needed.
It's like having a personal health assistant right at your fingertips, available 24/7 to provide support, answer questions, and connect you with the resources you need.
And these technological advancements are just the tip of the iceberg. The future of Medicare Advantage is likely to be shaped by innovations in personalized medicine, data analytics, and artificial intelligence, leading to more customized care, predictive health insights, and proactive interventions.
It's exciting to think about the possibilities.
It is.
But with all these potential changes, it's more important than ever for people to stay informed, advocate for their needs, and actively participate in shaping the future of healthcare.
You're absolutely right. It's like being a traveler in a constantly evolving landscape. You need to have a map, a compass, and the willingness to explore and adapt as the journey unfolds.
Now let's take a moment to address a question that often comes up when discussing the future of Medicare Advantage.
Okay.
How sustainable is this model, especially as healthcare costs continue to rise and the population ages?
That's a crucial question. Imagine a city that's constantly growing and evolving. Its infrastructure needs to be adaptable and resilient to accommodate those changes.
Right.
Similarly, for Medicare Advantage to be sustainable, it needs to address challenges related to cost control, quality of care, and equitable access for all beneficiaries.
So it's not just about adding bells and whistles.
Right.
It's about creating a robust and adaptable system that can withstand the pressures of a changing healthcare landscape.
Precisely. And that involves a multifaceted approach, including innovative payment models, care coordination strategies, preventative health initiatives, and technological advancements that can streamline care delivery and improve efficiency.
It's like building a bridge that can withstand the weight of time and traffic.
Yeah.
It requires careful planning, strong materials, and ongoing maintenance to ensure its longevity and effectiveness.
And just as a bridge connects 2 points, Medicare Advantage aims to bridge the gap between healthcare needs and solutions, providing beneficiaries with a pathway to a healthier and more fulfilling life.
That's a beautiful way to put it. Now, shifting gears a bit, let's talk about the human side of Medicare Advantage.
Okay.
We've discussed plans, policies, and trends, but what about the people who are actually navigating this complex landscape? What are some of the challenges they face, and what resources are available to support them?
That's a great point. It's easy to get lost in the technicalities,
Mhm.
but we must remember that Medicare Advantage impacts real people with real lives and healthcare needs. Imagine trying to navigate a foreign city without speaking the language or having a guide.
Yeah.
It can be daunting and overwhelming. Similarly, for many individuals, especially those who are new to Medicare or who have complex healthcare needs, understanding the nuances of Medicare Advantage can feel like navigating uncharted territory.
So it's about providing clear guidance, personalized support, and resources that empower individuals to make informed decisions.
Exactly. And there are fantastic resources available to help people navigate this journey. Imagine having a trusted travel agent who can help you plan your itinerary, book your flights, and answer any questions you might have.
Right.
Similarly, organizations like the State Health Insurance Assistance Program, or VSIC-TED-GB, offer free personalized counseling to help individuals understand their Medicare options, compare plans, and even address issues or concerns they might be facing.
It's like having a healthcare advocate by your side, someone who can help you cut through the jargon, understand your rights, and make choices that align with your individual needs.
Precisely. And these counselors are trained to provide objective guidance, ensuring that individuals receive accurate and unbiased information. They can help you explore different plan options, explain benefits and costs, and even assist with the enrollment process.
So it's like having a personal shopper for your healthcare needs.
Kind of.
They can help you find the best deals, navigate the fine print, and ensure you're getting the most value for your healthcare dollars.
And let's not forget the power of community and shared experiences. Imagine connecting with fellow travelers who have already explored the destination you're planning to visit.
Okay.
They can offer valuable insights, tips, and even recommendations. Similarly, connecting with others who are enrolled in Medicare Advantage can provide invaluable firsthand perspectives, real-world insights, and even emotional support.
It's like having a travel buddy who's already been there, done that, and can share their experiences, both good and bad.
Right. And there are online forums, support groups, and even social media communities dedicated to Medicare Advantage, where individuals can connect with others, share their experiences, ask questions, and learn from each other.
It's fantastic to see how technology can connect people and foster a sense of community, especially when it comes to navigating something as complex as healthcare.
Now, as we wrap up this part of our deep dive, I'm curious to hear your thoughts. What has resonated most with you about the human side of Medicare Advantage, and what are some of the key takeaways you'd like our listeners to ponder?
What strikes me is the importance of recognizing that healthcare is not just about policies and procedures, it's about people.
It is.
It's about understanding individual needs, providing personalized support, and empowering individuals to make informed choices that align with their values and priorities.
Beautifully said. And I think it's crucial to remember that while navigating Medicare Advantage can feel complex, there are resources available, people ready to help, and a growing community of individuals who are sharing their experiences and supporting each other along the way.
Right. It's about finding those connections, tapping into those resources, and embracing the journey with a sense of curiosity, determination, and a dash of human connection. Now, as we transition to the final part of our deep dive, I'm eager to explore some common questions and concerns that people have about Medicare Advantage. It's time to address those lingering doubts and provide clarity amidst the complexities. Welcome back to our deep dive into Medicare Advantage. We've journeyed through the ins and outs of these plans, explored the potential future, and even touched on the human side of this complex landscape. Now it's time to address some common questions and concerns that often pop up. Let's tackle those lingering doubts head on.
I like that approach. Let's clear the air and provide some much-needed clarity. One question I often hear is Medicare Advantage simply better than original Medicare? It's that classic debate that seems to spark a lot of conversation. What are your thoughts on that?
Yeah. It's not a simple yes or no answer. It's like asking if a sailboat is better than a powerboat. Both can get you where you want to go, but the best choice depends on your individual needs, preferences, and the type of journey you're looking for. Medicare Advantage might be a great fit for someone who wants that comprehensive coverage, predictable costs, and those extra perks like vision, dental, and hearing.
You've captured the essence of it. It's all about finding the right vessel for your healthcare voyage. But remember, while Medicare Advantage offers those attractive benefits, it also comes with some trade-offs, particularly those network limitations and potential prior authorization hurdles we've discussed.
Right. It's like choosing between a guided tour and exploring a city on your own. A guided tour provides that structure and convenience, but you might miss out on some hidden gems that you would discover by venturing off the beaten path. Original Medicare offers that freedom of choice, the ability to see any doctor or hospital that accepts Medicare, while Medicare Advantage typically restricts you to a network.
That's a great analogy. It's about weighing the value of structure versus that flexibility to chart your own course. And it's crucial to remember that Medicare Advantage plans are run by private insurance companies, not the government. So there's more variation in benefits, costs, and coverage rules compared to original Medicare.
So it's not a one-size-fits-all situation. It's about understanding those nuances, doing your research, and finding a plan that aligns with your individual healthcare needs and priorities.
Exactly. Now, another question I frequently encounter is, can I have both Medicare and Medicare Advantage? This often leads to confusion as people try to figure out if they can double dip in the Medicare pool. What's your take on that?
That's a common misconception. It's like trying to wear two pairs of shoes at the same time. It just doesn't work. You cannot be enrolled in both Original Medicare and Medicare Advantage simultaneously. It's an either situation. Medicare Advantage essentially replaces Original Medicare, providing the same Parts A and B benefits, often with added perks, but it's all managed through a private insurer.
That clears things up. It's about choosing a path and sticking with it, at least for a specified period. Now, let's shift our focus to prescription drug coverage, a topic that weighs heavily on many people's minds, especially as medication costs continue to rise. The big question is, are prescription drugs covered under Medicare Advantage? What insights can you offer on this?
Well, the answer isn't as straightforward as we might like. It's like ordering from a menu with secret options. Many Medicare Advantage plans do include prescription drug coverage, but not all of them do. Those that do are called Medicare Advantage Prescription Drug Plans, or MAPDs, which bundle Part D coverage right into the plan. It's like getting a combo meal, healthcare and medications, all in one convenient package.
That's a great way to put it. Bundling can offer convenience and potentially cost savings, but it's crucial to remember that not all Medicare Advantage plans include this Part D coverage. So it's essential to scrutinize those plan details before making a decision. Imagine going to a restaurant, assuming a dish comes with all the sides, only to find out they're extra.
Right. Don't get caught off guard by those hidden costs. Always read the fine print, compare plans, and make sure the coverage aligns with your medication needs. Speaking of fine print and navigating the complexities, another question that pops up is, can I change my Medicare Advantage plan anytime? I have a feeling you're going to burst that bubble of wishful thinking.
Well, I hate to be the bearer of bad news, but Medicare Advantage isn't a revolving door. You can't just waltz in and out whenever you fancy. You can typically only switch plans during specific enrollment periods, like the annual enrollment period from October 15th to December 7th, or the Medicare Advantage open enrollment period from January 1st to March 31st. Think of them as designated transfer windows in a sports league.
So you've got to strategize those moves and make those transfers during the designated periods. But I'm guessing there are exceptions, right? Life throws those curveballs sometimes.
You're absolutely right. Life is full of surprises, and Medicare has built in some flexibility to accommodate those unexpected twists and turns. Special enrollment periods might apply if you qualify due to certain life events, like moving to a new area, losing other coverage, or even qualifying for Medicaid. Think of them as get-out-of-jail-free cards in a board game.
Ah, those lifelines that can save the day. So while the rules and regulations might seem rigid at first glance, there's some wiggle room built in for those inevitable life changes. It's reassuring to know that Medicare has those safety nets in place.
Absolutely.
Yeah.
And remember, if you're ever in doubt or feeling overwhelmed by the complexities of Medicare, there's a whole support system out there ready to assist you. Organizations like the State Health Insurance Assistance Program, or SHP, offer free, personalized counseling to help you navigate those Medicare mazes. Think of them as your trusty GPS, guiding you through those unfamiliar healthcare routes.
And don't forget those helpful human navigators, like Medicare counselors and plan representatives. They're there to answer your questions, clarify those confusing terms, and help you make informed decisions. It's like having a personal travel agent for your healthcare journey.
Beautifully put. And as we wrap up this deep dive into Medicare Advantage, I want to leave our listeners with a final thought. Remember that Better Call Buckaloo slogan we chuckled about earlier? It's a reminder that even in the complex world of healthcare, there are those moments of humor, those glimmers of hope, and those human connections that can make all the difference.
Absolutely. It's about finding those resources, those allies, and those moments of clarity that empower us to navigate this journey with confidence and even a bit of joy. So to our listeners, as you continue exploring the world of Medicare Advantage, remember to stay curious, stay informed, and keep those nuggets of wisdom close at hand. and never hesitate to ask for help or reach out for support when you need it. After all, healthcare is a journey best traveled with a trusted guide and a sense of shared adventure.